for joining us on Coastal Expert. We have Dr. Huntley with Coastal Empire Plastic Surgery. Now, you all do a lot of things at Coastal Empire Plastic Surgery, don't you?
We do. We do the full spectrum of plastic surgery.
Okay, and I know that one of the things we're going to talk about today is things associated with the body contouring and surgical things that can be done to help improve our bodies. And one of the things that we hear a lot about is a tummy tuck as a surgical option. Exactly what is a tummy tuck?
Basically, women who've gone through having a family, the tummy gets stretched beyond its elastic limits, the muscles get pulled apart, and there's general laxity of the abdominal tissues, and it makes the abdomen protrude. So tummy tuck is basically taking care of those problems. It tightens up the muscle layer, it removes the extra skin, the extra fat, and it tightens up the skin and the muscle.
Now, what about scarring associated with that?
We try and keep the scarring as inconspicuous as possible, and for the most part we can keep it in the bikini line. So it's with underwear or bikini swimsuit, we can keep the incision where it's inconspicuous.
Okay, and now one of the things I noticed that was on your website is something called a mommy makeover.
A mommy makeover is the next step. For young women who've had a family, it takes its toll on their bodies. And it's not just the tummy that suffers. The breasts tend to deteriorate shape-wise. You know, the skin gets stretched, everything descends. So a mummy makeover includes restoring the breasts to their previous shape and size. Often there's a volume loss, and it may involve adding implants to restore volume, and it may involve a lift procedure to tighten things up and get the nipple complex back where it belongs.
Now, if I've had someone in my family or someone that I know that has gone through a tremendous amount of weight loss, there's something available called a body lift. Now, what does that do?
A body lift extends all the way around the midsection of the body. A tummy tuck deals with mainly the anterior portion of the abdomen, but oftentimes if you've lost a lot of weight, there's redundancy of skin all the way around the body. And a CBL or circumferential body lift, as it's called, involves removing that. And it's basically equivalent to lifting up, pulling up your pants. You know, if everything's falling, the buttocks, the thighs, and what we're doing is taking out that redundancy and tightening things up.
Okay. Now, there are surgical and non-surgical options for removing fat. Let's talk about the surgical ones.
What we just discussed is surgery. It involves an anesthetic and a formal procedure. Non-surgical options include the newest generation of fat removal, which is Sculpture. It's a laser device. It goes through cycles of cooling, then heating, and basically laser energy goes through the skin. The cooling cycle preserves the skin so that it's not damaged. The laser energy breaks up the fat and your body gets rid of it.
Now, this is something that has no downtime, right?
Virtually no downtime. There's minimal swelling, and it's a 25-minute session per treatment area, and you're up and moving and walk out the office. It can be done almost in a lunch break if you wanted.
Now, another surgical option is liposuction.
Liposuction is a surgical procedure usually involving an anesthetic that involves removing fat from under the skin, and it's applicable if the skin is in good shape and has good elasticity. We use a Vaser liposuction device that uses ultrasonic energy to break up the fat and also helps shrink the skin from an internal application. And that seems to be the best option in the liposuction field.
Now, one of the things that you all talk about on your website is complete to treat. Tell us about that.
The idea of complete to treat is some people have more fat than others in certain locations, and one treatment, although it can remove up to 26% of fat in the treated area, people may have more fat there than one treatment can take care of. So the treat to complete idea is that you can come back for subsequent sessions for a fixed price till you get to the result you're looking for.
Okay, so there's surgical and non-surgical options. Now, how do we know which to choose?
Really, that requires a consultation, so you can come in and discuss it with the surgeon. And basically, if it's just a fat problem, then the non-surgical options are a good way to go. If it involves a redundant skin, then skin removal requires surgery to achieve the optimal degree of tightening.
Well, we've learned today about a lot of options and treatments offered at Coastal Empire Plastic Surgery. If you have questions for Dr. Huntley or any of our experts, go to WSAV.com, click on Coastal Experts, and submit your questions.